Hey, Dr. Matt here. So talking about iron, and when it comes to pregnancy, iron, like I think most of us know now, is a key nutrient. Although I keep seeing it get overlooked because patients keep coming in with low iron levels, low ferritin levels, and anemic, and they're pregnant. I'm like, what is going on here? Somebody's got to take care of this. This is crazy, because both the mom and the developing baby must have iron, sufficient iron, optimal iron, to have a optimal pregnancy, an optimal delivery, an optimal afterbirth, and optimal breast milk production, and make sure that this baby, thrives in life. Because with each passing semester of carrying a baby, trimester of carrying a baby, the blood volume expands in a woman. And so as that blood volume expands, the need for iron to make up for that expansion grows as well. And same thing with the baby. The baby's growing, the baby's needs keep increasing. As humans grow, our needs increase. Iron is that key nutrient responsible for the development of the baby's brain. And often, we think about folate, B12, choline, inositol, these other nutrients, which of course are super valuable. But the deal is, without enough iron, no amount of folate, no amount of choline, no amount of inositol, it doesn't matter how much DHA you give the baby or the mom, it's not going to matter. You have to have the iron for the brain development and for optimal oxygen supply for the mom and baby, and just overall growth and maturing of the baby in a way that is going to allow the baby to think, man, I'm so glad you took care of me when I was in the womb and post-womb. So while the recommended dietary allowance of iron during pregnancy is about 27 milligrams per day, a mother's need tends to be a lot higher. And, the mom just doesn't tend to get that much from the food she's consuming, whether it's because of nausea or vomiting or whatever, or just not staying up with the expansion that's happening. So, prenatal supplements are recommended, have it containing iron and stuff. But the thing is, a prenatal, one of my buggers about most prenatals is that not only are the forms in the majority of prenatals, in fact, I don't know of any that are, inferior as far as iron, related to absorption, and side effect profile, and increase in nausea, and just all the discomfort related to pregnancy. But their potency is greatly hindered because of the packaging that the iron's in, and what else that iron is packaged within the prenatal, such as calcium, which directly binds to and hinders iron absorption. So if you're taking a prenatal and it has iron in it, I'm sorry, but you're probably not going to get what you need from it. And you're going to want to look for a prenatal without iron in it, and take iron separately. This is why me and many, I would say, leading paternity doctors recommend taking iron separately from your prenatal, so you can get everything you need from the prenatal, as well as get everything you need related to iron. Because without iron, you're going to suffer. So get a prenatal, or even just a good multivitamin without iron in it, making sure you're hitting the levels of B vitamins you need, and then take your iron about 2 to 4 hours after your multivitamin supplement. Or you could do the opposite. You could take the iron first and take your multivitamin supplement, prenatal supplement, 2 to 4 hours later. But you definitely want to make sure you do not have any iron in your prenatal. So on the day the baby's born, that baby will have approximately 270 milligrams of iron in their whole system. That's really that's not much iron to work with, right? And as they grow, their nutrient needs increase, and the iron supplementation, or potentially need for iron supplementation, also increases. And it's often necessary for mothers who are breastfeeding in order for them to get basically enough milk or not enough iron to their baby for mothers to supplement with iron. And if you're not breastfeeding and you're on formula, then it's even more a big deal to make sure your baby's getting enough iron, because the mom might have enough iron because she's supplementing and that kind of thing, but the lack of breastfed infant getting the formula may not be getting enough iron, especially when the iron is all gumbled up in one of these, all-in-one kind of things. So if you're lacking iron, your increased risk of like febrile seizures and stuff is going up for these babies. And nobody wants to experience that. I experienced that with my daughter, not fun at all. Had other patients experience it, not fun at all. So make sure that you're getting at least 4 to 12 milligrams of iron per day for your baby, per serving. If you're doing, a formula that has that is offering iron for your baby, because if you're not getting, in that range, then your baby could become anemic very, very easily. And if you're using formula, you might want to check out Mount Capra goat milk formula. Just type it into Google there, because they do have a great formula, a nice wholesome baby formula that is a mixture of different very specific ingredients and supplements that you mix all in together with goat colostrum and powdered goat milk, and it can be a powerful agent for the growth and development of your child. Definitely check it out. All right, so like I said, iron can be, it's necessity, but it also, of course, it's really challenging when you're formulating supplements and infant formulas to get enough iron without overloading the system and not having massive side effects and leading to poor compliance, and people just like, forget it, I'm not taking it. I'm just gonna go through life iron deficient. I might have developmental issues, whatever. But we got to get iron where it needs to, where we need to get it. So this is why I am so passionate about Blood Vitality, which you may have heard me speak about it before. But Blood Vitality, it's a special blend of essentially a matrix of where we stick these minerals inside a rice protein, and then we give it in a capsule form, and it makes it so gentle on the stomach, so easy to absorb. It keeps the mommies happy, keeps the baby's tummies happy, and their body's thriving, their mind's thriving, development happening just like we needed, because now they're getting enough iron. And my wife, it was a big deal for my wife when she had her twins, getting her iron levels up. And then our last little guy, my wife's iron levels tend to be awesome, and then they dive down when she gets pregnant. And but immediately we saw, okay, they're down, boom, Blood Vitality, popped them right back up. And I've seen it happen so many times now. It's still so satisfying every time I see it, to be honest. But check it out if you haven't already, if you're dealing with any of that kind of stuff, because iron, often overlooked. I think because it is so commonly, it's so commonly deficient that we're like, and historically it was really challenging to get levels up because there's so many side effects related to these different supplemental interventions. So if you have any of those side effects, if you've had awesome results, love to hear about them. Put it in the comments. If you had issues related to iron, doing everything possible and still low, still not changing, ferritin levels still low, put it in the comments. Now let's see what we can do to help you get those levels where you need to get them, and make sure your babies are thriving. All right, Dr. Matt here. Please like, subscribe, and send us out to your buddies, your mamas out there, anybody with kids, so they know that they are at least for sure checking their iron levels, checking their ferritin levels, so that they're not suffering for no reason at all.